It's just allopathy medicine. I think a lot of it is going that way. So though there may be a lot of strengths to allopathy, but we are not doing the right thing presently.
Thank you. I think it's a good beginning. It's not competitive thing. It's only complementary. And this is the high time we have to think about the usefulness of alternative therapy in support of
allopathy. Sir, I am a neurophysician from SRM Medical College Hospital. Now there is a DST sponsored program which is going on, complementing the Indian systems of medicine using the Medhya Rasayana in neurodegenerative disorders. So now there's a program that is going on, which is a DST sponsored program, and that is an international program, multicentric international program. There we have the School of Boston. They are also participating in this program. So like what Sir said, somebody else brings our material to us, it becomes sweet.
Yeah. Last question by Professor Ramsamy. He was my professor, mentor, and hand over the mic to...
There's one more question.
I think.
One more.
I can shout, there's no problem. I can raise my voice. Can you hear?
Yes.
You can hear?
Yes.
No problem. I can raise my volume to reach the last bench. Anyway, I think I'm just reinforcing all this. From my personal experience, I would thought this armamentarium in alternative medicine, I'm a very strong advocate of hypnotherapy. I have treated about 2,500 cases. I'm writing a book on that. That's a different thing. I can talk a verse on it. About Ayurvedic medicine, I developed osteoarthritis from, say, for last 1999 onward. And I first went to VHS. I was prescribed some 3 oils, combination of 3. Then I went to Shanmugadas in VM Street. I have been using Ruja Nil oil for last so many years, and after my hip replacement, I was asked to do replacement of the knee, but which I scrupulously avoided because it's a tricky business, and I find that I'm not taking any allopathic medicine for my arthritis. There's no pain. I walk freely. I use regional massage because I combine it with spiritual. I'm a devotee of Sati Sai Bhagavan, therefore I say Sai Ram, and then go on rubbing it, allowing it for half an hour to soak, and then take my bath. It has worked excellently. And another area where I used oil for the epithelialization was varicose ulcer. My grandson told me, he was an MS, now he's a plastic surgeon. Tata, he said 6 months it won't heal. So I accepted what he said. I respect, even though he's my grandson. And I respect. Then apart from allopathic creams and all that, I also used epithelializing Ayurvedic oils, and I have no sign of the varicose ulcer now.
Thank you so much. That is the secret of 90 plus not out.
Thank you to Dr. Emma and her whole team for bringing out the integrated approach. Thank you very much. 3 suggestions from my side. One is, like, can you get a, 3 suggestions from my side is, can you get a chemical analysis of the coconut oil which is coming from outside? 1. 2 is, for the other patient, like, could you investigate him for a shower of strokes, small strokes here and there, so that he doesn't get a recurrent stroke in the future? 1, 2, and 3rd is, like, to all of these members who are present here, like, one patient's treatment is entirely dependent upon the follow-up of the patient. Like, how the patient behaves in a period of, say, about at least 5 years. So please record all these findings and please have a follow-up of these patients so that you can record what happened to these patients, what happened to the so-called coconut oil, and is there continuing to be taken up, and list down all the drugs which are being taken and what all is going on actually. Fine. Thank you very much.
Thank you. Thank you. Thank you very much. Last comment.
Just a small comment on the coconut oil. There is a scientific survey on the use of coconut oil. Whenever the patient has a hyperlipidemia, we say not to take oil. This is what. But the SASA, that's an international committee, has found the average society level of cholesterol and triglycerides, LDL, compared to other places, is much lower, higher in Kerala. Still, the incidence of coronary heart diseases or the vascular diseases due to obstruction is much less. Still, nobody has an answer for it. In the last international conference, SASAT conference, there is no clear-cut answer. They do not know why, in spite of a high level of LDL, still the people living in Kerala do not have so much of heart attack. There are so many theories. Maybe the coconut oil, though is elevating it, is protecting the heart. Maybe. And second, the landscape has go up and down. Maybe the exercise is more. Nobody can see. But one thing is sure, coconut oil is not harmful scientifically as per the survey.
Thank you very much. It's my privilege to thank all of you. And as somebody said, it will be meticulously followed because they have the strong belief, TriMed group of institutions, success without sustenance, is not good. So any success in the organization depends on and sustainability. For sustainability, it needs discipline and meticulous follow that they are doing. So I hope. So let us give a big hand to the group of doctors who are involved in this. Thank you. Thank you very much. Thank you.
Thank you very much, Chairman, Chairpersons, and thank you, Dr. Rama, for your wonderful presentation of both cases. And I request the Chairman to give a memento to Dr. Rama. Yeah, join. Dr. ESK to give the memento to the Chairman. To Dr. Jayavelan.
Just to say that the TriMed logo is a bilva leaf, and therefore it's a bilva plant that we have given our chairpersons for being at this session. I think we're at the end of 2 long days, and first I must say, please give yourselves a big hand for being such a good audience and having lasted 2 long days. I think it's been a wonderful feast of elder care thoughts that we've all shared, and I hope it will improve all our clinical practices. It will get us thinking, we'll innovate, we'll do new things when we go back wherever we are working. And I sincerely hope that this has at least made us think about the elders as a special group whose needs are very special, and we have every duty to meet those needs, not just as individuals but also as professionals. Very happy to say also that the Royal College is very keen to keep doing this, so I think you'll you'll hear more about geriatric care workshops from the Royal College of Physicians of Edinburgh. So watch this space is what I would say. I'd like to thank, I think, especially the Royal College delegation, because they've taken the trouble to come all the way. Some of them had to fly back this morning to be back with their families and get back to work tomorrow morning. Some go back tomorrow morning, but I think they've all made the effort to come all the way. And special thanks in their absence to all of them for being with us. And I think but for Marundeshwara Enterprises, who have looked after the conference arrangement, Vision Hire, who've taken care of the audio visual, Accolade, who've taken care of the press, and of course the entire team in VHS and the team at TriMed who participated in the organization, this would not have been possible. So thank you to all the faculty, Indian faculty, and thank you to every one of you. Please do enjoy coffee before you go away. Thank you so much.